Hello everyone, welcome back to GrowMed. So welcome back to another session where we will be discussing some important one-liners from the orthopedic. So as the exam is near and you have to do now a lot of work, right? Like revise the whole 19 subjects, then solve the previous year questions. Not exactly solve, but look at the previous year questions, the high yield topics, and it becomes very hectic. Okay, so here I am to reduce your work and to make your work easier. So we will be discussing quickly the orthopedic one-liners. So this will be a short video and you can watch it in your free times also. And in this video, we will be mainly discussing the previous year questions and the one-liners which are asked. Okay, so let's start the video. The first question, the blount disease is involvement of proximal tibia. Okay, so involvement of the DIP and the PIP with sparing of MCP and wrist is seen in the osteoarthritis. Okay, because there are various conditions which will be involving this DIP, PIP, and the wrist, like the rheumatoid arthritis, then the psoriatic arthritis, okay, then the osteoarthritis. Okay, so it is very important to differentiate between these because they can be confusing in the exam. Okay, so whenever there's involvement of the DIP and the PIP with the sparing of MCP and wrist, then it will be the osteoarthritis. Then a mantadenoma affects which bone? So it will be mainly affecting the tibia, and this was a PYQ asked as a one-liner. And the images of these bone tumors, I have already uploaded a video with the name of the radiology images, and I have discussed all the important bone tumors in that video. So the link will be given in the description box to watch that video as well. Then in gamekeeper's thumb, there is injury to the ulnar collateral ligament. Okay, simple one liner. Then this is also previous year and a repeat topic. Then 3 bone knee point relationship has a diagnostic value in case of the elbow fracture. Management of the type 1 olecranon fracture is immobilization of the elbow, and above the elbow we need to put a plaster slab with 30-degree flexion. Then avascular necrosis of the femur head is due to the involvement of the medial circumflex femoral artery. So injury to this will lead to the avascular necrosis of the femur. Then the most important finding of the TB knee is the reduction of the space joint. And also this can be described in the other words like reduction in the limb, shortening of the limb, sorry. And there are various questions described, like a patient who has TB, he had come with certain findings. So what all findings can be seen in the patient, except kind of a question was asked, and there are various things which were described. Then the very next important question is the most radiosensitive tumor, and it is the Ewing sarcoma. Okay, so this is an important topic. So questions are asked like in relation with the radio also, that which is most important or most sensitive, most radio resistant organ, then tissue, then tumor, and all the things. So you need to remember all those things. And these things are covered in the radiology videos, so do watch that video also. I will give the link in the description box. Then type of displacement seen in dinner folk deformity. So dinner folk deformity, this deformity is related with the Colles fracture. Okay, so whenever you see this, then the Colles fracture should hit your mind. And in the Colles fracture there will be supination and dorsal displacement of the radius. And do look at the images also, because image based question can be asked on this. Then test used to identify flexion deformity as to the hip joint, and it is the Thomas test. Then difficulty in shrugging of shoulder is seen when there is spinal nerve injury, and spinal nerve supplies the trapezius muscle. So whenever there's injury or damage to any of these things, you can see that the patient is having difficulty in shrugging of shoulder. Then the nerve injuries, complete video on the nerve injuries I have already made and uploaded in the YouTube, so do watch that video as well. Then bone which is most likely to fracture in fall on the outstretched hand is the scaphoid. Then management of the patellar fracture is the K-band wiring, and image based question can be given. Okay, so they can give the image of the patella fracture and they can ask what is the management. Then treatment of the club foot, it is the triple arthrodesis, and what happens in the triple arthrodesis is we will be doing the fusion. So fusion of the three joints, as already written, triple. So the three joints which are fused are the subtalar, talocalcaneal and calcaneocuboidal joints. So all these three joints are fused. The most common location of the fracture of the clavicle is the medial 2/3 and the lateral 1/3. Asked multiple times this fracture, a clavicle ka fracture. Then a fracture of the C2 vertebra. This is called as the hangman fracture. Then glass holding cast is used to treat the scaphoid fracture. Image based question can be asked. So they can give the image of this glass holding cast and they can ask it is used to treat which of the following fracture. Okay, so just an image also can be given and asking identify the cast. Cock-up splint, this is used for the radial nerve injury and image based question is also being asked on this cock-up splint. The knuckle blunter splint, which is the claw hand and ulnar nerve injury happens in this claw hand deformity, and for the treatment we will be using the knuckle blunter splint. Aeroplane splint, this is used in case of the brachial plexus injury. Dennis Brown splint, used in the congenital stapes equinus vagus, which is also called as the club foot. So image based question can be given of this club foot. So they'll give the image of the club foot and they'll just ask which splint is used, or they can also give the images of the splint and they can ask which splint it is. Then most likely nerve to be injured in case of anterior shoulder dislocation, it is the axillary nerve, and hip dislocation, it is the sciatic nerve. Okay, so the dislocations, the hip, the elbow and the shoulder dislocations, all these are important, and see these are also classified into various categories like the anterior and the posterior, and x-rays can be given. So they can give the x-ray and they will ask which kind of shoulder dislocation it is, whether it is anterior, it is posterior, and hip also same, they can ask anterior or posterior. So from the ortho mainly images questions are asked and some simple one liners based on the management and all. So as it is quite easier subject, comes in integration with a lot of things, the tumors which are discussed in the radiology, so do watch the radio videos also to cover the tumors from there. Then the nerve injury is covered in the anatomy, and the various diseases rest all covered in the medicine like the rheumatoid arthritis, then the psoriatic arthritis, then various vertebral injuries like TB, port wine spine seen in the TB, then any metastasis in case of the cancers, that those things are covered in the various other subjects. Okay, so if you integrate this orthopedic with the various other subjects, then it will be easier and you can easily complete it also. Anterior Latchman test is done to identify the anterior cruciate ligament. Then injury to the anterior cruciate ligament. Most common nerve injured in the knee dislocation, it is the common peroneal nerve. Then supratendinitis. So this is an infection of the supraspinous tendon, and the movement between the 60 to 120 degree will be painful. Deglowing injury. It is the injury of the skin and the subcutaneous fat. These are stripped from the underlying fascia, and image based question is asked on this deglowing injury. Important from the surgery point of view also. Most common organism causing the acute osteomyelitis is the Staph aureus, and McMurray's test is done to identify the meniscus injury. Okay, so these were some important one-liners which are asked in the orthopedic, and hopefully 2 or 3 questions can be repeated from this. So watch the video at least twice before the exam, so that if you watch the videos on a repeat mode, your memory will be good and you'll be easily able to recall the things. Thank you so much guys for watching this video. If you find this video useful, then comment below, like the video, share it with your friends, and if you're new to GrowMed, subscribe to GrowMed. I am Dr. Padmini, your mentor for the FMG. Once again, thank you and all the best for the FMG. Bye bye.